Welcome to the Healthcare Executive Podcast, providing you with insightful commentary and developments in the world of healthcare leadership. To learn more, visit ache.org. And without further ado, your host, Chris Caraggio.
Hello, everybody. Welcome to the Healthcare Executive Podcast. I'm your host, Chris Caraggio. A reminder, today's episode is brought to you by Elsevier. As misinformation multiplies, giving your clinicians easy access to the most trusted, current, evidence-based information is more important than ever. Elsevier's Clinical Key can help. Download the executive brief at trustclinicalkey.com. Okay, we are very, very pleased and honored to have as our guest. Let me introduce him, read his bio, then we'll get into the conversation. Mr. Rick Pollack, President and CEO of the American Hospital Association. Rick started his career as a legislative aide on Capitol Hill, working for Representative Dave Obey from Wisconsin, who served on the House Appropriations Committee. While in Congressman Obey's office, he learned the intricacies of the legislative process and policymaking. Now, Rick has spent more than 3 decades with the American Hospital Association. After leading its Washington, D.C. office and guiding its legislative advocacy and public policy activities for more than 20 years, Rick was tapped in 2015 as the AHA's president and CEO. He's passionate about assisting America's hospitals and health systems as they care for patients and communities, and has been a leader in efforts to expand health care coverage overall for everyone. Now, Rick received his bachelor's degree in political science and communications from the State University of New York's College of Cortland and his master's degree in public administration from American University in Washington, D.C. And Rick, obviously the hospital field is certainly fortunate to have somebody with all your experience and skill at the helm of this, greatest public health care crisis of our lifetime. So we know you're busy. We want to welcome you into the Healthcare Executive Podcast. We really appreciate your time.
Chris, thanks very much for having me, and thank you, ACHE. It's great to be with all of you.
Definitely. Okay, let's get into it. I know AHA uses what is called the 3 R's as a framework for describing how hospitals need to overcome things and issues, obviously, in this pandemic. Just for everyone's sake, what are the 3 R's?
I'd be glad to share that with you, Chris. And if I can just set a little context right up front, we've reached the 1-year mark of dealing with the pandemic. It's taken 500,000 lives. We all, I think, lost, certainly mourn the loss of these individuals, a toll that has left gaping holes in the lives of those left behind. And while the slope continues to decrease somewhat, and hospitalizations and deaths are now beginning to go down, we're still at a very dangerous level. And, it's a concern that many of our patients still reluctant to seek needed medical services, some of which has demonstrated a decline in life expectancy in this country. But, in the midst of this, Chris, for more than a year, the men and women of America's hospitals and health systems have served patients on the front lines. They've been battling wave after wave of virus and exhaustion in caring for millions of Americans. And, they recently had that JP Morgan conference that many attend. And Dan Michelson, who's the CEO of Strata Decision Technology, observed that hospitals are simply too vital to fail. And he asked the question, what will we have done without them? And he went on to say that when our nation needed us most, and when it faced perhaps its most challenging moment in the history of healthcare, our nation's hospitals and health systems stepped up heroically and performed miraculously. Chris, I couldn't have said it better myself. So I just want to say right at the outset to the ACHE that to all the caregivers, the doctors, the nurses, the respiratory therapists, the pharmacists, to those who clean the rooms and bring the food and secure the facilities, we want to convey our gratitude for their hard work and dedication in protecting patients and caring for communities. And, it's been a team effort from the corner office to the back office to the boardroom. ACHE, you're all healthcare heroes. Now, to your question, the 3 R's. The 3 R's really relate to COVID, and the first R has been relief. And that has been our efforts over the past year to seek relief in the form of regulatory waivers to allow executives to respond in a quick and decisive manner to the situation. The second piece of relief has been with regard to financial relief. And there have been 5 COVID relief bills passed. We're working on a 6th as we speak. And it's provided billions of dollars in relief. So that's the first R for COVID relief. The second is recovery. And it's meeting the challenge of needing to be ready for any emergency, any surge or spike, but at the same time being COVID safe, so that we can continue to care for the sick, the injured, and keep people healthy, and, oh, by the way, remain financially viable. Striking that balance around recovery, that's the second R. Third R is rebuilding. What do we learn from this experience? When we step back, what do we reevaluate? What do we reboot? And what do we reimagine in terms of trying to create a better healthcare system? That's what the 3 R's are about.
Okay, so let's focus on that third R, the rebuilding and reimagining. What is that gonna look like in your expert opinion when we're talking about the healthcare system, and what will change down the road because of all this?
Well, one of the things that we've seen then is pretty clear is that hospitals are indisputable trusted partner when it comes to taking care of America. But some of the things we're going to see that need to change. Public health. I think that what we have seen is many hospitals and health systems have stepped into the gap, and they have fulfilled the public health role. What is the new intersection between hospitals and their role versus the traditional public health structure? And by the way, as we've seen, the traditional public health structure has been severely underfunded, and we've got to rebuild that. We're also going to see, I think, a new era of emergency readiness. It's clear that the stockpiles didn't work. It's clear that we never had the capability to do the kind of contract tracing that's necessary for this pandemic or the next one. Another thing in rebuilding, I think we've all seen a greater awareness around health disparities and the need to tackle those. That's going to be part of rebuilding. Rethinking the healthcare supply chain. I don't know that we'll ever again find ourselves in a situation, or we shouldn't, of depending upon one particular country for any type of supplies or equipment, particularly PPE. When it comes to hospital operations, I think that what the pandemic has shown is that we need to think about new models and alternative sites of care, new staffing models to support those alternative sites of care, whether it was for testing or vaccines, or now to better able to take care of people at home. When it comes to physical plant, going to need more swing space, more adaptability. Those are the kinds of things that I think will change. When it comes to the delivery system, one of the things that we have to consider here is that the pandemic is going to expose the fragmented nature of the delivery system. We're going to have to deal with long haulers, as they call them, that have chronic conditions. We're going to have to deal with the fact that financial viability was very much at risk when non-emergent services are shut down. We're going to have to deal with care deferred during the periods in which people were hesitant to come back to care. So what does that all mean? It means telehealth. That cat's out of the bag. Virtual visits, while it can't replace everything, we're going to see more and more of that. We're going to see more remote patient monitoring. We're going to see more movement of care from inpatient to outpatient, if not to retail. There's going to be a race for providing care in the home, and a movement toward alternative payment methods that support these different delivery mechanisms. Another thing that I think that we'll probably see is more healthcare system consolidation. I think we've seen the value of health systems and systemness demonstrated in the ability to move resources around, whether they be physical resources in terms of equipment and supplies, or human resources in terms of healthcare person power. So those are the types of things that I think we have to consider in the context of rebuilding.
Definitely. Such a detailed answer, Rick, about just that, because everyone's always asking, what's it going to look like on the other side post-pandemic? So thank you so much for that clear, distinct answer of what needs to rebuild and what it's going to look like post-pandemic. Okay, let's talk about the +3 component to AHA strategy when we're talking about the future. It has to do with equity, workforce resilience, and overall behavioral health. Where do these issues fit into to rebuilding and overall building a better health system?
Well, you hit it already. I mean, you hit the big three. And we kind of refer to our strategic plan revolving around the 3 Rs that we talked about, and then the big three. And the big three are 3 challenges that we had before COVID that just became more challenging. And you just mentioned it. It's the workforce and resiliency and the need to ensure that we have the appropriate mechanisms in place to care and support for our own teams and to leverage public policy so that we can be more effective in how we work, whether it's promoting team-based care, licensure reciprocity, increasing resources to have more people. So that's one thing. When it comes to the issue of behavioral health, clearly that has become more challenging, and we just have to work harder to find ways to coordinate behavioral health services with physical health services, need to more vigorously enforce the parity laws that treat mental health and physical health in the same way. We need to think more about training at the basic level, because we'll never have enough specialists to take care of the people that have issues related to behavioral health. All primary care providers, nurses and doctors need to have more intense training in dealing with behavioral health issues. We need to deal with a whole variety of things in that regard. And then health equity. There's the moral imperative to do the right thing for sure. And then there's the business case for health equity in terms of being more attentive to cultural competencies. We'll never deal with some of the issues with regard to health equity unless we understand and deal with the issues of disparity. So those are the big three. And boy, we could drill down a lot into each of those three even further.
Got it. But thanks for pointing all that out. We appreciate it. Hey, just a reminder to our listeners that this episode is brought to you by Elsevier. As misinformation multiplies, giving your clinicians easy access to the most trusted, current, evidence-based information is more important than ever. Elsevier's Clinical Key can help. Download the executive brief at trustclinicalkey.com. Okay, Rick, we are recording this early March 2021. President Biden's been in office right around 6 weeks or so. What are the administration's top priorities when it comes to healthcare, and are you encouraged so far?
Number one, their priority is setting up a government. We still don't have an HHS secretary in place. His confirmation vote's working its way through the committee process this week. So really, having HHS secretary and that whole structure put in place, that's certainly a top priority. The second one we've already seen them begin to move on, and that's unwinding things that the Trump administration did in terms of executive actions. They put a lot of restrictions. The Trump administration did that is on the Affordable Care Act. We already see the Biden administration promoting enrollment, funding navigators, and dealing with some of the regulations that ultimately made it easier for certain skimpy plans to qualify for the ACA public exchanges. Also seeing them unwind other rules, some by executive action, the public charge rule that created barriers for people to take advantage of Medicaid because it might be held against them for achieving citizenship. That's something that's being unwound. Medicaid work requirements, that's something that's certainly being unwound. So reeling back to things where the Trump administration went in a different direction, that's been a priority. COVID is the number one priority, and we share that, and that's what encourages us. And let's face it, for President Biden, that's a legacy issue. If that isn't dealt with effectively over the next 18 months, that will, be real problematic for the whole Biden administration. And then coverage expansions. That's something that's high on the list. We're already seeing that emerge in the COVID relief bill that's working its way through the Congress as we speak. So, yeah, I am encouraged. I'm encouraged because we support unwinding some of those previous executive actions. I'm encouraged because we share the top priority of the Biden administration, and that's winning the battle against COVID. And I'm encouraged because we want to see those coverage expansions. And I'm encouraged that he's committed, as we are, to building on the Affordable Care Act as a good foundation to continue to both expand coverage and improve the delivery system.
You mentioned the latest COVID relief bill, which is expected to pass soon. What piece, you mentioned it, but what pieces of the bill, I guess, for you, do you look at as possibly having the greatest impact when it comes to hospitals, when it comes to health systems?
Well, I'll divide that into, two categories because there are things that are in the bill that are very important to the whole healthcare system. And then there are things that were not in the Biden plan and are not in the House passed version that we're working to get into the Senate version. So, the fact of the matter is that the increased money in the House version that passed the House for vaccination and testing, that's all good. There's like $80 billion in there for that. The coverage expansions I mentioned earlier with regard to Medicaid and the expansion of subsidies in the health insurance marketplaces, the subsidies for COBRA, federal subsidies for people that lose their jobs so they can continue coverage. That's all good. That's all in the House bill. We support all of that. The additional assistance under the rural health grants and support for childcare and families, that's all good. We think that's all good. That's in the House bill. But again, there are things that weren't included in the House bill, that weren't included in the Biden plan, that we're disappointed weren't in there. And we're working to get those into the Senate plan. Those things more directly affect hospitals. The Provider Relief Fund, where over $170 billion had been dedicated over the last year. There is no replenishment of that fund. We're working to get another $35 billion included. The sequester, the Medicare sequester that we got put on ice for the last year, that 2% cut that's automatic, that's going to expire at the end of March. We want to get that extended. And then the loans or accelerated payment that was provided to us, we'd like to get that turned into loan forgiveness. That's not in the plan. So those are the three that we're trying to get in the mix as the Senate begins to look at their plan right now.
Rick, how confident are you that you'll get all those three, or maybe two of the three, as we move along to seeing it passed overall?
Well, I got to be candid. It's an uphill fight and it's a challenge. I am confident that we've got good support. In fact, the $35 billion passed as an amendment to the budget resolution in a non-binding way, led by Senator Joe Manchin of West Virginia. There is support there for additional funds into the Provider Relief Fund, and I'm hopeful that we can get that done, and we're working real hard on those other provisions. But, it's a challenge because over the past year, Congress did, in fact, provide a lot of funding. Between the $175 billion in emergency relief and another 50 or 60 billion in policy changes, there's a perception out there that we were already shall we say, taken care of. We think that there's a lot more to be done as we play a lead role in vaccinations and on the front lines. I think the other thing is something, Chris, that we have to recognize is the political system that we have in this country. They tend to only respond to short-term emergencies. When there's an emergency, they tend to respond. Right now, people see a downward slope, so they don't see the emergency the way we saw it roughly a year ago, and that clouds things when there are other priorities. And then the last challenge we face has to do with this reconciliation process, very complicated process, and it involves all sorts of parliamentary gymnastics. But the three things that we're trying to include run into these hurdles as to what you can include in a so-called reconciliation bill, which is a fast-track method that they use to avoid a filibuster in the Senate to allow it to pass with 50 rather than 60 votes. You've probably heard the debate on minimum wage, where the parliamentarian ruled that the minimum wage increase couldn't go in a reconciliation bill. We have similar issues that get way technical that I'd be glad to explain, but I know we don't have the time, that present hurdles for us in this process as well. But we're working it hard. We've had advocacy days. We have a TV campaign going. We unveiled new studies showing that we're losing between $53 and $100 billion this year as a result of taking care and preparing for COVID. That's on top of $300 billion we lost last year.
Finally, Ray, and great. Thank you for that. You definitely are working it. So we'll see how it plays out here in the near future. Okay, Rick, you're going to be joining us in a few weeks for ACHE's 2021 Congress on Healthcare Leadership. More than 7,000 hospital and health system executives are expected to join for this virtual event. What would you advise maybe are the top leadership skills the field is going to need to drive everything that we've talked about over the last 20 minutes to a half hour and see this through that third R, that rebuilding?
Well, the biggest challenge is the balance, striking the balance between having to deal with the immediate and the urgent, and being prepared to also concentrate on what you have to do to meet the challenges of the future. The immediate and the urgent, where we have a responsibility for providing essential public services that are life-saving, and ensuring that our frontline staff have the equipment and the resources to deal with the situation. That's immediate. And trying to deal with the changing signals that we get from the government and the lack of commercial payers' willingness to step up to the plate and help, that is something that is critical. But at the same time that we're dealing with these immediate issues, we have to keep our eye on the long-term issues so that we can stay viable to serve our communities, and so that we can redefine the H. That H, that hospital sign, that building has proven to be a trusted partner, and that's indispensable. But at the same time, we need to begin to reach out into the community and to provide care in different ways, whether it's in the home or in outpatient clinics or in other sites, so that we're more accessible to patients. So it's balancing the immediate but preparing for the long term. I think that that's the biggest leadership challenge we've got right now.
Well said. Thank you so much, Rick, for this conversation and all the insight. We really appreciate it.
Happy to be with you and look forward to being at the Congress in a couple of weeks.
I wanted to say that. So as Rick just said, you're going to hear more from him, the president and CEO of the American Hospital Association, at the Congress on Healthcare Leadership, March 22nd through the 25th. Learn more and register at ache.org/Congress. One final note for our listeners. Today's episode is brought to you by Elsevier. As misinformation multiplies, giving your clinicians easy access to the most trusted, current, evidence-based information is more important than ever. Elsevier's Clinical Key can help. Download the executive brief at trustclinicalkey.com. Thank you so much for joining us. We'll see you next time on the Healthcare Executive Podcast.
This has been the Healthcare Executive Podcast, brought to you by the American College of Healthcare Executives. If you've enjoyed the show, please consider rating and reviewing on iTunes or your podcasting app of choice. And for more information, find us online at ache.org.